Hello and good afternoon. I want to welcome everybody to this week's update of our COVID-19 coronavirus pandemic situation problem we're having. First, I want to thank everybody for all the extra work that they're doing. Thank you very much. I know it takes a lot of time and stress. I don't want to jinx us, but knock on wood and more prayers. We are COVID-free. We still are here within our reservation, our people. And the people that are helping us get through this, I say thank you all very much. My people, we should have nothing to worry about financially. Food, water, do not worry. Do not have one worry. We are on it, and we have people on it working with us to secure these things. Again, thanks everybody for the hard work that they're doing and helping us. With that, I want to turn this over to Mona Zavante. Mona.
Good afternoon, Winnebago community, and welcome to the WCHS update again this week. I just wanted to point out that this is Public Health Week. In normal times, the work of the Winnebago Public Health Department often flies under the radar for most of us. Their success is marked by what does not happen: injuries avoided, chronic diseases prevented, infectious diseases that are contained and fizzled and never make the news. Over the past several weeks, people have come to understand that local health departments play key roles in every aspect of our everyday lives. The emergence of and response to coronavirus has meant huge disruptions for all of us. While many of us have been forced to scale back our work, we have scaled up to meet the challenges of the coronavirus and lead community responses. While many of us have correctly followed the urging of our local, state, and national leaders and stayed home, our teams are working 7 days a week on the front line. We are contacting and monitoring people who have been in close contact or have other risk factors. At the same time, we are working to help all sectors of our local communities understand how to protect themselves and others from infections. We are working to contain corona infections with our elderly and our disabled, our most vulnerable population. We are working arm in arm with our 12 Clans Unity Hospital. We're coordinating to make best use of our scarce resources like tests, masks, gowns, and respirators. We are also monitoring the health of our healthcare teams. We are communicating daily with local, state, and federal partners to stay up on the quickly changing COVID-19 guidance from the CDC and from the Nebraska DHHS. We are synthesizing and relaying key information to local partners as schools, businesses, and faith-based organizations. We are fielding thousands of phone calls from people like us, community members with questions and concerns. We are sharing the information we need so that all of us can work together to flatten the coronavirus curve and protect our healthcare systems capacity to serve our communities. National Public Health Week is observed the first full week of April. We are grateful to the dedicated teams at the Winnebago Public Health Department. We urge you to show your gratitude for their work by heeding their advice to all of us during this public health emergency. Stay home as much as possible, keep at least 6 feet distance from any people we do not live with, and wear a mask while out in public. Avoid gathering in any groups other than with people we live with. If a group is necessary, limit it to 10 people, and remember the 6 feet rule. Wash your hands often for at least 20 seconds each time. Cover your nose and mouth with a tissue when you sneeze or cough, and throw the tissue away. Avoid touching your face, eyes, and mouth with unwashed hands. I want to thank everyone for staying at home, practicing social distancing, and isolating and limiting your errands. Thank you to all of the Winnebago Public Health Department, the 12 Clans Unity Hospital, the Tribal Council for your hard work and dedication. It does not go unnoticed. I appreciate the willingness to all work collaboratively together and for a united message presented. I will now introduce Angie Keller, our Public Health Nursing Director, to start our presentation.
Good afternoon, and I want to thank everyone for joining us with the coronavirus community update and preparedness response. The first thing we're going to go over is the statistics of the local and national statistics, and these were of April 7th of this year, so I believe that was Tuesday. The U.S. total cases were 374,329. U.S. total deaths was 12,064. The travel-related cases for the coronavirus was 1,669, and then close contacts were 6,847. For the state statistics, Nebraska currently on the 7th had 478 cases. There were 12 deaths. There was 6,961 total negative cases or negative tests that were completed. And then the total number tested was 7,453. Currently, Winnebago and Thurston County have 0 cases of coronavirus. There has been 6 tests completed here at the WCHS, and those tests have all been negative. The symptoms of coronavirus most commonly are fever, cough, shortness of breath. There has been some new research and some new data stating that diarrhea, loss of smell, loss of taste have also been noticed, and then extreme fatigue. So we want to go ahead and include those on the symptoms. So if you're experiencing any of those symptoms within 2 to 14 days from exposure, we do want you to contact your healthcare provider or the Winnebago Public Health Department to let us know of the symptoms. We will guide you through the restrictions or information that's needed at that point to help you get through that as much as possible. Many of the individuals that do come in contact with COVID-19 or are diagnosed with it are mild, and they are able to self-care at home. The best source of prevention for COVID-19 is with social distancing and then proper hand hygiene with washing your hands and using alcohol-based scrub. With social distancing, you want to make sure you're avoiding groups, and that's inside and outside. You want to stay at least 6 feet apart from others and that's going to help protect the spread of the COVID-19 infection within the community. We're asking that nobody partake in any contact sports. That's with any sport that includes touching or even close with one another. Germs are invisible and they can spread very easily. We're asking that parents do not partake in any play dates. Good alternatives for those is to write letters, visit online, do Zoom calls or conference calls or anything virtually. Avoid bringing kids together in playgrounds and playing in groups. As always, you want to maintain a 6 feet distance between you and another individual. That's the best way to go ahead and to prevent the spread of the COVID-19 virus. There has been some more information coming about homemade masks and using them to prevent the spread of the COVID-19 virus. Right now, we're asking that community members do wear masks when they are running errands, and that is not going to prevent them from getting the infection or getting the virus. It's actually going to prevent those that are asymptomatic from hopefully spreading the virus to community members. We are accepting donations for these homemade masks. There's a donations box set up at Rolling Thunder Wellness Center, and you can call the CHR program at 878-2277, and they will help bring the masks, pick them up, and to give them out to the community members that are needed. If you do need a mask, we do ask that you call the CHR program, and you'll be placed on the list, and once they are available, that you will be contacted and one will be delivered to you. We are asking anybody that is wearing a mask to refrain from touching the outside of it. That's the area that is going to be the most contaminated. So when you touch that mask, you're going to contaminate those fingers and then increase the chance of spreading that to yourself or to other individuals. We're asking with those homemade cloth masks that they are washed daily, and we want you to wash them on the hottest setting that the fabric can handle, and then with the acceptable amount of laundry detergent. And then always hang them to dry. Do not place them on a counter or any other surface to dry. Please hang them. WCHS has issued new visitor restrictions for the hospital, and I'm going to go over those a little bit with you now. Due to the COVID concerns that comply with the CDC guidelines, 12 Clans Unity Hospital and Winnebago Public Health Department has must make the steps to reduce the risk of exposure in our community. Although there are currently no confirmed cases of COVID-19 in our local area, the fewer people with whom our patients come in contact with is the less likely they will contact COVID-19 and other infections. For this reason, we are implementing visitor restrictions for all areas. Effective immediately, there will be until further notice, no visitors will be allowed in the healthcare facility. In case of a person with limited ability or unable to understand or communicate, only one accompanying adult is allowed. In that case, the individual must be 19 years older, either immediate family member, power of attorney, guardian, or patient representative. Any adult accompanying a minor or incapacitated patient must be healthy with no symptoms of fever or respiratory illness. The guest Wi-Fi is now unavailable at this time. We want to thank everyone for their understanding and cooperation with this manner. And then with that being said, I'm going to go over what to do if you do become sick. We are asking that you stay home except to get medical care. It's very important that you limit your exposure to the outside community because we want to limit the risk of exposure of COVID-19 or any other infection. You want to separate yourself from other people within your home. You want to try to do that social distancing within the home, and if you can, to socially isolate. If you do need medical treatment, we are asking that you call ahead before visiting your doctor or contacting your primary provider or even the Winnebago Public Health Department, and then we will help facilitate what needs to be done to get you treated or to get you seen by the provider. Please wear a mask when you're around other people. Clean your hands often with soap and water or with alcohol sanitizer with at least 60% alcohol. Cover all coughs and sneezes with tissue, as what Mona had said. We want you to monitor your symptoms. If there is a case of COVID-19, then the public health nurses will be contacting you to help monitor those and checking in on you daily. We want you to call the Winnebago hotline at 402-922-1508, and then that'll go to one of the nurses with the Winnebago Health Department, and they'll guide you through what needs to be done if there's any questions or concerns. And then, of course, we always do want you to seek medical treatment if your symptoms do worsen, but we do still ask that you contact us before coming into the facility. And then when to seek medical treatment or if your symptoms do worsen, those symptoms are normally with an increased difficulty breathing or shortness of breath, persistent pain or pressure in your chest, new confusion or inability to arouse, and then bluish lips or face. With that, you do want to call your healthcare provider, put on a face mask if you have one available, or if you do need emergency services, those will be available, but we do ask that you notify the dispatch personnel or the individual that you're contacting to let them know that person does have the respiratory issues and that could be a possible COVID exposure. This will help give us time and have the EMS staff prepare for the PPE they need to get in order to properly treat you. And now Laura Gamble's going to go over things that has changed with the 12 Clans Unity Hospital.
Good afternoon, everybody. I hope everybody's having a great day. We've had a few changes in the hospital, but not a lot. We're working on processes daily and trying to keep up on everything, so I'll go over those with you right now. So how has this affected the Winnebago community? As was said previously, there are currently no positive cases reported in the Winnebago community. We only have one entrance now going into the hospital, and that's limited to the east entrance. All patients are now being screened at the door. And then anyone that enters the building will be required to wear a mask. So anybody that comes in, whether they've screened positive or not, will be wearing a mask. Masks will be given to you at the door by the screener. Patients are instructed to call their healthcare provider or the COVID-19 hotline before coming to seek any medical treatment. Due to the COVID-19 concerns and to comply with the CDC guidelines, 12 Clans Unity Hospital and Winnebago Public Health Department must take steps to reduce the risk of exposure in our community. That is why we are decreasing the visitors or having no visitors at all. And Angie did go over that with you. Any visitor accompanying a patient that is coming in with a child or somebody that can't make decisions must be healthy. We really ask that you help us enforce that. We know that that's difficult, but we've had a little bit of trouble enforcing that. And it's hard on our staff because they want to let people in, but we really, for everybody's safety, we just can't do it. And even bringing your children with you to an appointment, it's really not safe. We need them to, if we can find alternate childcare, if you have an appointment or you need to come to the hospital, that would be great. Staff attending patients will be wearing the personal protective equipment, and you'll see them wearing face masks, shields, gloves, gowns at times. Patients that come in for testing will be tested for other things first. So we always look at what else could be going on with the patient, and so we'll do a flu or a strep test first. If the test is warranted, the COVID test is warranted, and we follow strict guidelines through the health department, then we will test. The state lab takes about 12 to 24 hours for those to get back, and then if we send a commercial lab, it takes 2 to 4 days. And we'll go over in the questions at the end, but we will be getting some 15-minute tests, but not very many, and that will be coming from IHS. 12 Clans Unity Hospital and most other hospitals, our size cannot run these tests. And so currently, right now, if we are able to get some of those tests, we will be very fortunate. Evidence does suggest, though, that over 80% of the infections that people get are mild, which is a fever, maybe a slight cough, and might not warrant a healthcare visit or even a test. Capacity and supplies of COVID-19 laboratory testing cannot currently meet the demand of everybody that wants to be tested, and that continues to this day. A simple clinical diagnosis of COVID-19 infection could include self-isolation at home and should be the norm, even in the absence of a positive COVID lab test. These could change if more testing becomes available, and we look at that every day. On the next slide here, you'll see some of our employees, and the sign they're saying, holding up is, "I stay at work for you, please stay at home for us." And we appreciate everybody following that, and everybody's been very good about that. What we've done in the outpatient clinic is that we right now are not doing routine, non-urgent elective clinic appointments. We're only doing the same day appointments, Monday through Friday. Those people that really need to be seen by a provider, those are the ones that we're seeing. Patients should call ahead for same-day appointments. There will be no express care on Saturdays until further notice. And plans are in progress to increase our telemedicine in both the outpatient clinic and the emergency department in case any of our providers get sick or we have a significant increase in patients. This is one of our emergency department nurses here. 12 Clans Unity Hospital Emergency Department. If you are experiencing a mild illness, please call ahead for guidance on whether you should come in or if you should use self-care measures at home. The emergency department is open as usual, but we are working on plans to care for an increased number of patients. And we have no idea when that's going to happen, so we have to be ready at any time. If you come to the ED with respiratory symptoms, such as a cough, shortness of breath, you will be asked to put on a mask. And again, everybody will have a mask on at this time. And we will place you in a special waiting room so that we can come and take care of you. At the pharmacy, right now we're filling 90-day supplies. We started a drive-through pharmacy. The pharmacy hours are Monday through Friday, 8 to 5. That's worked really well. Patients should call ahead so medications can be ready. And if you don't call ahead, it might take just a little bit longer. Staff will be wearing their personal protective equipment, and that's one of our pharmacists with hers on right there. Over-the-counter medications such as ibuprofen or Tylenol can also be obtained at the drive-thru, and regular inside pharmacy operations continue as usual. Other precautionary measures that we're putting in place, limiting the number of people in the facility, and really we've decreased that by 60 to 70% right now. Staff and departments throughout the hospital are working from home or teleworking, and they're being rotated. We still have to maintain operations at the hospital, and so we're trying to do that as best as we can without putting anybody in danger, and also limiting the amount of people within the facility. Additional supply orders have been placed, and we are monitoring existing supplies of our personal protective equipment on a daily basis. So just a final slide here, but what can you do to prevent the spread? We can't say this enough. Social distancing, wash your hands, avoid touching your eyes, nose, and mouth. If you're going to wear the mask, don't touch it all the time. Don't touch it. If you do, you have to wash your hands. Avoid close contact, and stay home. If you're sick, stay home. If you're not sick, we really want you to stay home too. On behalf of our entire WCHS team, we appreciate your cooperation and efforts to keep our community safe and healthy. And I just want to also say that, thank you to all the employees at WCHS. They are really putting in a lot of work, and I think the community should be very proud of them.
And now we'll have a statement by the Winnebago Pandemic Task Force Chairman, and that is the Winnebago Tribal Council Vice Chairman, Mr. John Snowball. After that, we'll have a statement by the CEO, Esther Mercer.
Good afternoon. The Winnebago Pandemic Preparedness Task Force had its second round of meetings this week. And things are really going well. These are unprecedented times, so it warrants unprecedented coordination through the tribe's organizations, and that's what is happening. The task force has identified specific areas of food security, federal funding, business employment, health, utilities, security, communications, and education. And we have coordinated our various entities, and our best people are sitting at around these tables and these subcommittees to ensure that the Winnebago tribe is moving forward in a coordinated effort during this time. Now I'll give an update on the Winnebago tribe. Winnebago Tribe of Nebraska services remain available to the tribal membership. Please go to the tribe's website under the tab COVID-19 for information regarding the departmental hours of operation and the contact information. Programs that serve clients such as food distribution, WIC, the human services continue to be available to help tribal members who may be experiencing food security issues due to the pandemic. The tribe submitted 3 grant applications this past week with the intent of acquiring funding to help support COVID-19 related expenditures. The task force is meeting almost daily to coordinate efforts and to share information between the various organizations that operate on the reservation. We are continuing to evaluate our operations and make adjustments as needed to minimize the risk of exposure to our staff, while also continuing to provide the critical services to the community that our tribal membership rely on, especially during these uncertain times. The tribe will be closed tomorrow in observance of Good Friday. Please have a safe and happy Easter. Winnebago Tribe of Nebraska. And on behalf of the council and the task force, we would encourage the community members to practice social distancing and to take this serious. Take this serious for the children, take this serious for our elders and for the group of people who are high risk. So we can do this, but it's going to take all of us, each one of us. There can't be a weak link in this chain. So let's come together during these times. Thank you.
Thank you, John. And now we'd like to call up the superintendent of the Winnebago Public Schools, Mr. Dan Farringer, to give a statement. And then on the line, after Mr. Farringer, we'll have Manoj from Little Priest Tribal College. Dan.
Good afternoon. My name is Dan Farringer, Superintendent of Schools at Winnebago. A couple of updates. I just want to reiterate the governor mandated the school closure, including all activities and events through May 31st, 2020. The track and athletic complex have been closed until further notice, and that is for the safety to help reduce the COVID-19 exposure. Again, our food service staff and those helping deliver have been and will continue to work hard to ensure the children get breakfast and lunch. I want to remind everyone there will be no deliveries tomorrow or Monday due to the Easter holiday. On Tuesday, April 14th, we'll have 2 deliveries again, breakfast and lunch. On Wednesday and Thursday, there'll be 1 delivery, and starting Friday, the delivery will include the following Mondays and Tuesdays meals, and then on Tuesday afternoon or Wednesday morning, they'll be getting a delivery once a week that will include meals through for a whole week. So it'll be through Tuesday, April 28th. We're really trying to avoid the contact and help avoid spreading the coronavirus. Also, the pickup, it'll all be delivered. Packets and the food will be delivered. There will be no pickups at the school. Try to avoid that contact. I'm trying to cut down on the essential staff needed at school on a regular basis. There'll be very few staff members at the school building during this time. We'll deliver the packets on Tuesdays and Wednesdays as we deliver the meals. So we're trying to follow the regulations set forth by the directed health measure and other new guidelines that pop up daily. Another thing that's coming up and we've been questioned about is graduation. We thought we had a plan, but then the governor put a hex to that, so we're trying to come up with another plan. Going to visit with the board on Tuesday night at the board meeting. I'll have that, the advertisement on our website. It will be Facebook Live because it is open to the public. One of the things we're looking at, we do want to honor those kids, those students that have achieved that status, but we can't do it in the traditional ceremonial way at this time. So we're looking at having something where the kids drive by, pick up their totes, we'll Facebook it live, stream it, and then we're looking at the 9th right now of May, and then having maybe an open house in the fall to honor those kids in a different way. We really believe that we need to get the diplomas to the kids, the students who have achieved this status, and so we'll continue to work on that. I'll have more information next week regarding that. And I just want to reiterate, we're really working hard to help stop the spread of the virus, and if, again, follow the simple rules that have been sent out by many entities throughout this journey here we've had with this COVID. And if we can continue to do that, we'll be a lot safer in the end. Again, thank you for your time, and we'll continue to push forward.
Thank you, Dan. And now on the telephone line, we have Manoj from Little Priest Tribal College. Manoj, are you there?
Yes, Darren, can you hear me?
Yep, the floor is yours, Manoj.
Okay, thank you, Darren. Hello, everybody. My name is Manoj Patil from Little Priest Tribal College. Here is our update. Little Priest Tribal College is offering free tuition and fees for all summer courses. So I repeat, Little Priest Tribal College is offering free tuition and fees for all summer courses. Students are responsible for textbooks and access code only. This is the first time we are doing this. Summer semester is completely online to avoid contact and to maintain social distance. So summer semester is completely online. Please contact Office of Admissions starting April 21st, 2020. Please contact Office of Admissions starting April 21st, 2020 to start registering for summer semester. Little Priest Tribal College parking lot is infused with high-speed Wi-Fi starting today for students to access their coursework without leaving their cars or trucks. So they drive to our parking lot and they can log in to our system and do the coursework. Just now, an hour back, U.S. Department of Education just passed $6.2 billion in emergency student aid that needs to be distributed to the students through the Department of Education Title IV requirements. So we are working with the Department of Education to find out how much money we're going to get and how the money will be given to the students. So please stay tuned for that one. That's a pretty big news. Starting April 16, 2020, LPTC will be restricting access to buildings to very essential employees only to, again, minimize contact. So it'll be only 3 or 4 employees who are considered very essential for the operations of the college. Wolf's Den is donating food and drinks to Winnebago Senior Center or anyone who needs it on a weekly basis. So if you're in need of any food or drinks, please contact Deb Chamberlain of Wolf's Den, Little Priest, Tribal College to get the material, to get the food items. The Little Priest Tribal College is working with 12 clans, a hospital, to provide additional housing for their staff. We are still in the discussion. Nothing has been decided yet, but at least we are in the initial stages of discussion. Right now, we are trying to clear the dorms by mailing the materials of the students to the students who were residing in the dorms as they had as they had left the buildings with not taking all the stuff. Pro rata refund will be issued to the students as well based on the housing needs and stuff like that. Also, the main thing, some of you have heard this, Little Priest Tribal College has successfully completed its focus visit from Higher Learning Commission with all core components met. That is the update from Little Priest Tribal College, Winnebago.
Thank you, Manoj. Appreciate the update. And then also we have Mayan Beltran from Winnebago. And to the viewers and the people that are tuning in on Facebook, we do have a question and answer session by the health professionals as well as some of the tribal officials. Mayan, are you there? Mayan, are you able?
I am. Can you hear me?
Yep, we got you, Mayan. The floor is yours.
Hello, can you hear me?
We can hear you.
Yeah, I'm trying to talk. Can you hear me? Oh, okay. Okay, good afternoon, everybody. This is Maya Beltran, General Manager of Winnebago Casino Resort. Just to provide a little update, we are following recommended guidelines by the national level and the state level to remain closed until April 30th. We continue to monitor daily the Governor Reynolds press conferences to understand how things are going in Iowa, the latest numbers on coronavirus. Obviously, on the west side of Iowa, there are more and more cases coming up daily. And it's important to note that we at Winnebago Casino Resort have no but we wanted to make sure that everybody knew that if you bought tickets or had interest in any of the upcoming concerts that were last month or this month, we have postponed those until further notice. They are being rescheduled throughout the year. So we will have those concerts coming back if you're very interested in those. And I just wanted to reiterate to everybody our appreciation and thanks to all essential staff of the Winnebago Tribal Network, the Winnebago Hospital, our security, surveillance, and essential staff at Winnebago Casino Resort. You guys rock, staying there, protecting our facilities, keeping things running, and taking care of everybody, servicing our needs. So we can't wait to see you guys very soon, and we'll keep you updated on our weekly basis from Winnebago Casino Resort. Thank you.
Thank you, Mayan. Also, Manoj and Mayan, if you could stay on the line, just in case any questions come across the Facebook live feed or the YouTube chat feature. And at this time, we'd like to invite Mr. Sam Bursch from Ho Chunk Incorporated. Sam.
Good afternoon. I'm Sam Burrish with Ho Chunk Inc. I have a few new items to share this week. For our Pony Express stores and Sweetwater cafes, we have new social distancing guidelines in place. This applies to the convenience stores, the grocery stores, and the Sweetwater Cafe in Winnebago. These guidelines include limiting the number of customers in the stores, for customers who are waiting in line, encouraging distancing, also employee separation. We have new designated hours for seniors and higher risk individuals at the Pony Market in Winnebago and Food Town in Walt Hill. Those special hours are Thursdays and Fridays from 7 a.m. to 8 a.m. Also, we are installing sneeze guards. We've discontinued self-service food for non-packaged items. Indoor seating areas are closed off, and we're continuing with the frequent cleaning, employee education, and other activities. For the community's elders, as a small way of helping out, Ho Chunk Inc. has mailed a check for $50 to each enrolled member of the tribe who was age 65 by April 1st. That's about 450 elders. They will also receive the annual holiday check this December. Ho Chunk Inc. also made the first prepayment installment of the 2019 dividend payable to the tribe this week for $200,000. Overall, the company is operational and earning new business as part of the federal relief programs. Of course, the well-being of our employees continues to be our top priority. We've implemented a new COVID-19 paid leave policy for non-contract employees. Also, as a reminder, the Winnebago office locations continue a telework rotation. Any visitors are by appointment only and subject to screening. And finally, we're also continuing local collaboration with the Winnebago Public Health Department on the call to action for making masks for our community and frontline workers. Those are all the updates I have today. I thank you for your time.
Thank you, Sam. At this time, we would like to introduce Emily Longeski from the Winnebago Comprehensive Healthcare. She is the Communications Director, as well as the panel, as we're going to go into the question and answer.
Hi, everyone. So I just want to give the reminder that for any community members who have questions, you can submit them on the live stream Facebook chat feature or YouTube chat feature. And we will do our best to answer those. Also, you can email any questions you may have to covid@winnebagotribe.com, and we will try to answer those and include those in next week's live stream as well. So, without further ado, we have healthcare officials from the health department and the hospital here to answer some of the questions we've gotten in the last week. We'll start off by the first question. Someone submitted on the news, they said there's a ventilator shortage. How many do we have on hand? And I'll direct that to the hospital.
Okay, that's a great question. And first of all, I just want to have everybody realize that it's not common for small hospitals to have ventilators. That's why we transfer people to a higher level of care. With that said, 12 Clans does have one ventilator. This ventilator is used mainly for short-term use. Most hospitals, and including 12 Clans small hospitals, do not have staff such as respiratory therapists or anesthesiologists or CRNAs that can run those ventilators for long-term use on patients. We do not have an intensive care unit at 12 Clans Unity Hospital. That is why we do transfer patients to other facilities. We do understand that, we want everybody to understand that we are looking at plans on how we can get through that and working with other facilities on what that looks like. And there's another question later that I'll answer on that.
Yep, so in relation to that, the next question is, do we have a mutual agreement with Omaha or Sioux City or even Pender to accept tribal patients that need ICU? What happens when those hospitals get overran?
Yes, we do have agreements with Sioux City and Omaha. They do take our transfers now, and they will continue to take our transfers. Pender is a smaller hospital. They transfer their patients that would need ventilator use too. They may have a couple more ventilators than us because they do have anesthesia there. But as far as Sioux City or Omaha, they will take our patients until they are seeing influxes. And we hope that doesn't happen, but if they're getting a ton of patients too, we're working on plans on how we can take care of patients at 12 Clans and what that would look like.
Great, thank you, Laura. The next question is directed for the health department. It states, I heard someone called in and they said just to self-quarantined. Are you guys still coming out to check on our elders? Do you protect the transport people? Are you still having clinic? Personally, I'm a diabetic and I have a sore on my foot. What do I do? Mona, would you want to answer that?
So depending on the symptoms that you're experiencing, we may ask you to stay at home for a certain amount of time. Constantly calling into the hotline, or the PHNs will be following up with you. So yes, we tell you to stay home as long as you can. The health department is calling a bunch of the vulnerable population. So through the diabetes, the public health nurses and the CHRs. So if you wish to be checked on and you haven't been, please call the diabetes program and they can get you on that list. Each of the MVOs, the CHRs, have personal protective equipment in each of their cars, and so they are so they provide protection for them and the people that they are serving. So the outpatient department is still having clinic. You can walk in. They are looking at doing some teleservice, and I'm sure Laura can expand on that. If you are in need of diabetes care, you can call the diabetes program, and specifically for your foot, and they can provide further guidance.
Great. Thank you, Mona. Did you want to add anything about the clinic, Laura?
Yeah, it would be good if you need to come to the outpatient, we're still there for you, but we would like you to call first, and then we can kind of talk to you and tell you where to come and what's going to happen, and try and get your symptoms ahead of time. The other thing with telemedicine, we're really looking at how we could use that, and we had a meeting today, and there are a lot of ways to use telemedicine, and so more to come on that, and please be open to that if we have to roll that out. We want to make sure that our providers don't get sick, or if they do get sick, we have a way that people can get care.
Great, thank you. Next question, do you guys have a PPE shortage? Does all your staff have PPE, including the x-ray department, lab department, security, housekeeping? If a person comes into the hospital, they're worried it would spread fast.
All right, currently we have enough PPE, but with that said, we don't know how long this is going to last, so we have to conserve our PPE very appropriately, and we look at that on a daily basis. If this lasts for a long time, we have to continue to order PPE and make sure that we get enough in. But right now, every employee is able to have the PPE or the protective equipment that they need to do their job. We're bringing in employees and asking them what they feel they need or how comfortable they feel they are in their setting. And we're listening to the employees, and we want them to feel safe, and we want them to feel like they can come to work and do their job.
Okay, thank you. This one is directed towards the health department. I saw in the news that beef packing plant employees are getting coronavirus. Does that mean that meat is contaminated and can spread that way? Angie, do you want to?
So with the coronavirus being a novel virus and limited information is available regarding this, currently the thought of how the coronavirus is spread is from person-to-person contact via droplets. That's why we ask for the social distancing and to wear masks to help prevent those droplets from being spread out into the air. There's no evidence right now from the CDC that supports that the COVID-19 infection is associated with any contaminated food. Before preparing or eating any of the food, it is always important to wash your hands and prepare it properly. Always wash your hands with soap for at least 20 seconds. And then continue to do that throughout the day. You just don't want to do it when you're preparing foods. You want to do it with any high-touch, whenever you do any high-touch surfaces, always wash your hands or do hand hygiene with the 60% alcohol hand sanitizer. You should always handle and prepare your food properly, so make sure it's cooked thoroughly. You want to separate any raw food or meat separate from all your other foods. Refrigerate any perishable items, and then always make sure that the food or the meat is cooked to the correct temperature so that way it can kill any germs or bacteria that's in there. And then it's not recommended, but it is definitely something you can do if there is concerns. You can always wipe down any of the items that you bring into your house prior to putting them away. Just wipe them down, let them sit for a period of an hour or however long you can, and then you can put those away, and that would help prevent any of the contamination from happening as well.
Great, thank you. Another popular question we've gotten is, can my pet get COVID?
So at this time, there's no evidence that companion animals, including pets, can spread COVID-19 to people, or that they might be the source of infection in the United States. So the CDC has not received any reports of pets becoming sick. So I'm sure we all seen the Facebook post that had the poor little big cat, that got corona. And so there is canine and feline coronaviruses that can make them sick, but it's not transmitted, that strain, to humans.
Okay, thank you. A few questions regarding testing. So Laura, I think these are probably directed for you. So do we do the testing here? It was mentioned that there's a self-test. Do we have any for our elders?
So currently we do not do testing at 12 clans. There's no really community hospitals that are doing testing. This testing is being done at the state level and at the commercial labs, the bigger labs. I do not know of any self-test that is being done. I haven't heard of any self-test. And so that is not something that can be done. So that is not available at this time.
And then just to touch with Laura, they can obtain the sample to run the test, but they cannot complete the actual testing for the positive or negative here at the facility. Those do need to be sent out, but the samples are obtained at the hospital.
And in relation to that, a couple people have heard that IHS is getting 15-minute tests sent to them, and I know you spoke on this earlier in your presentation. But a few community members are worried, since we're no longer IHS, will we get excluded from that? And can you speak on that?
So we just found out yesterday that we will be included in that, and we are looking right now at getting 22 tests that can be done at our facility. With that said, that's only 22 tests, and so we will have to have criteria for who gets tested, and those will be the critical patients that come in, or the sicker patients, and we have protocols for that already.
Great, thank you. And then lastly, there's been some discussion about community members getting stimulus money, is there any recommendations on what they should buy with that stimulus money?
So right now, there's many people that have been laid off and they're counting on the stimulus money to help meet their needs, their daily needs. So the most important thing that you're doing with that stimulus money or the stimulus check is to make sure that you're using it appropriately. You want to make sure you're getting your household items that are needed, food, toiletry items, anything that you're going to need, because we don't know how long this is going to last. So we want to make sure that everyone has the supplies on hand that they need. So it's important to make sure that that stimulus check is going to those.
Okay, thank you. Great. So I think that wraps up our questions. Did we have any Garen questions in the live stream or in the chat box by chance?
Just a few questions on the test, but I think that Laura cleared that up. The tests are on their way, and there's a limited amount, but just a couple questions on that.
Okay, great. So then, thank you very much, Mona, Angie, and Laura. At this time, we're going to invite up the Tribal Council to answer some questions that were directed towards the tribe. So.
We'll just start off the first question. Are we going to do a curfew? Other tribes doing a curfew and people are getting pulled over if they violate the curfew. So at our meeting, one of our last meetings, a motion was made and it went unopposed to authorize Big Fire Law and our public health to work together to develop a curfew ordinance. So that has been set in motion, and some council members, there's support to enact it right away, but the actual enactment of the curfew has not been decided yet. What else has been worked on is a shelter-in-place order that is in the works also. We're working with the public health and the community leaders and law enforcement and various entities to come up with a shelter-in-place order and what that would look like and how it can be effective. The second question, have you been going through all the offices and sanitizing them? What is environmental health doing? So I guess I could just speak on what I have viewed. I viewed a lot of employees sanitizing the area. There's not a lot of areas that are open to the public at this time. Probably the post office is the only one, and I see our employees sanitizing throughout the day. What has the pandemic task force been doing? So one of the food portion of that, we just recently, or there's a resolution that the tribe is considering now that allocates $89,000 to the food portion of the task force, and the task force is developing a plan, and it's gonna happen very quickly. The task force has identified it as an item that needs to be dealt with urgently, and what we're looking at is food that has a long shelf life and stockpiling food for our community. Other things that the pandemic task force has been doing, what's called the first wave of funds that are coming is the Small Business Association has put out a payroll protection loans to the various, and through our tribal organizations, some of our entities can utilize that, and we have identified that, and we have made those applications. So that was really something that went well. You know, none of our entities got left out. They worked together. Is the road to the river being watched? Do we have a lot of out-of-town plates going down there? This is something that Councilwoman Kitchian had brought up in a meeting, and I had addressed it and I said that I could handle it on the department level as I'm the Wildlife and Parks Director, and we have identified that area as being shut down to non-community members, and those enforcement plans are being made by Jewel Parker, Conservation Officer, the lead Conservation Officer. Can you please consider difference or delay rent, utilities, electricity as a tribal government? Can you request that the corporations like NPPD, even HCI? I really thought about this. This is the question that we had last week too, and I said it was a tough question. But I can definitely put it up to the task force and the council, and maybe we could figure something out and what actually we can do with this. And another thing that has come out is where the tribe as a government is developing guidelines to businesses on how they should be dealing during this pandemic. And that would relate to the food stores, the gas stations, and even Dollar General, because we've identified Dollar General as a place that needs to take some responsibility for our community during these times. Garen, do any other questions come in?
Yeah. Chairman Brown, as we head into the holiday weekend, is there anything that you suggest to keep the kids are getting restless? Is there anything that you suggest that they do this coming weekend?
Just try and keep them at home, but I know we just had discussions that we may try and close our local parks for the safety of the children, our adults, and our elders. So let's really try and practice these things that we need to be doing to be safe. Like I said, we are virus-free right now, knock on wood, and let's say them prayers more. One thing I want to note, though, when we close Winnebago to our tribal employees that will be going through this shortly, their employees started seeing unemployment benefits already. So the process should go by quick. Have a good weekend.
Oh yeah, Garen, I'll speak on that a little too as well. Today we had our task force meeting, and the kids keep coming up and talking about their meals and how they're doing, and so we said, well, maybe we need another committee, another group of people thinking about our children. So we developed the education portion, and now we have the Winnebago Public School, the Educare program, Little Priest Tribal College, St. Augustine's, and our education director here for the tribe. And that's a good thought. We need to think about our kids during these times and how they're doing. How they're doing to make sure they're being taken care of. So that's good. That's a good question for that group that was developed today.
This is the last question that we got. Is the tribe going to do layoffs?
Yes, we are. Layoffs and furloughs should start next week. You will get notification. We do apologize for that. We wanted to avoid that, but we are working hard. We have stations getting set up right now, and hopefully it goes smoothly. Like I said, Winnebago, they started their layoffs March 17th, and they already started seeing unemployment benefits. And I hope that it goes that smooth on the Nebraska side. Thank you.
So on the CEO report, during our meeting, we passed a policy, and the policy was to identify the workers during this pandemic, and it was essential, exempt, essential, non-exempt, and modified work schedule and furlough. And so our CEO and our CFO have been doing the hard work to identify the employees, the bare essential employees that we can go through and operate as a government, provide services to our community, and to operate through FY20 through the December 30th. And so we have those plans, and we got to move forward. And these are tough decisions that some people have taken on, but we're ready. We're going to move forward as a community and ensure that all of the resources that are available to our employees are going to be made available, and I see these stations that are set up in the gym, and I kind of wondered what they were, but now I know. So like the chairman said, we're standing together. We're going to stay together during these times. Thank you.
Thank you, Chairman Brown and Vice Chairman Snowball. And that is today's weekly COVID-19 live stream. Folks, tune in for next Thursdays. With that, we're going to be signing off. Thank you.
Mm-hmm.